We are going to discuss Pseudoxanthoma Elasticum. In the roots, it is written in the heading of disorders of ectopic calcification and abnormal mineralization. So, whenever we talk about the Pseudoxanthoma Elasticum, the first thing that comes in mind is the elastic fibers fragmentation. So, we forget about the second component, which is calcification. That is very, very, very important. So, along with the fragmentation and the degeneration of elastic fiber, you have to remember the calcification of elastic tissue as well. Now, moving straight forward to the point that are important from the exam point of view, the first thing is most important complication, most earliest complication of the disease. Second thing is most earliest ophthalmic complication. Third is your obstetrical risk. So the most earliest complication is skin changes that is present in the teenage years or the early childhood, and most earliest ophthalmic complication is your PUD fundus, PUD orange fundus, not angioid streaks. Obstetrical risk, there is increased risk of miscarriages due to faulty placental development, due to abnormal placental development. First trimester. And the second thing is there is 12% of pregnancies suffer exaggerated skin manifestations. Now coming back to the important points of the topic, it is autosomal recessive disorder, and there is ABCC6 gene mutation. There is fragmentation plus calcification of elastic fiber, and unfortunately, there is no treatment available for this, and you have to deal with the morbidity and mortality that is present. This is the mnemonic for the Pseudoxanthoma elasticum, that is chicks. C for chicken skin, that is plucked appearance, that is also called Moroccan leather or the chicken appearance. Second is the hemorrhage, which is very important. Upper GI bleeding is associated with this, and the mortality of this Pseudoxanthoma elasticum is due to hemorrhages, either cerebral hemorrhage or GI bleeding or placental abruption. Then is indigo blue sclera, also called angioid streaks. Angioid streaks are the radiating slate gray colored streaks that are present from the optic head. Then carotid artery disease, claudications in the calves and peripheral vascular disease, and squeaky valves, which is MR, AR, and aortic dissection.